Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert, and we are here today, along with, of course, my incredible co-host, Dr. Millicent Rovelo. How are you doing?
I'm doing well. How are you?
I'm good. I'm excited for this podcast.
I am too. Who do we have with us?
We have our fellows for 2024 to 2025
Yay! We're so happy to have you.
Thanks for having us.
Yeah, it's great to have you guys on. We want to talk to you, let people get to know who you are, since you're going to be with us for a year, which I think is probably the right amount of time for a fellowship.
I think so, too.
It's
I think
just
6
enough.
months is too quick.
Too short.
And it's probably about actually 10 months and 23 days is probably the right amount for this fellowship.
Yes.
By that 24th day, it starts to be like, okay, I'm over this.
Everyone's wearing a little
We're ready.
thin
I got to
on
get
each
to my
other.
job. When am I going to start making money? It's time.
Next step.
Yeah, so let's explain that. Like, what is a fellow? Like, who are you? Well, I'll explain it, then I'll ask you guys to tell us a little bit about your training.
Yeah.
So a fellow, in the sense that we're using it, these are doctors who have completed all of their plastic surgery training already. That means that they did college, they did medical school, they did 6 to 8/12 years of plastic surgery residency.
That's true.
to
Several years.
to get their plastic surgery credentials. They could go out right this minute, hang a shingle, call themselves board eligible, board certified plastic surgeons, and do any procedure in plastic surgery that they wanted to. What they have chosen to do is do an additional year of voluntary training, God bless them, in the art of aesthetic plastic surgery to really fine-tune and hone those skills.
Right, and it's not just about even the surgery. It's about how to run a practice, how to do all the things that you have to do to run your aesthetic practice. So let's start off with your introductions. We have Dr. Hillary Jenny, who is coming to us from Johns Hopkins University.
Yep.
And we have Dr. Xiao Zhu, who is coming
Yep.
to us from my alma mater.
Your alma mater.
The University of
Good old
Pittsburgh.
Pittsburgh.
We got a panther in the house, which is really cute.
Not saying that's why you got the position. You were extremely overqualified, but that was a bonus.
And my mom did go to my wife did go to Johns Hopkins. My mom did not go to Johns Hopkins. I'm gonna tell you that right now. My mom was lucky, no, she did great. My mom was amazing. But my wife went to Johns Hopkins, so we have a soft spot in our heart for Johns Hopkins University, and it's an incredible medical center for sure. I mean,
Yes.
both
Yeah.
the places that you trained are, they're really top of the top. So we're happy that you chose to come and do this fellowship, which is, it's a rigorous deal to do more training after you've done so much training.
Yeah.
Yeah.
So why don't you guys introduce yourselves from a sort of a quick resume standpoint, where you went to undergrad, medical school, and we know where you did your residency, but you can say it again, and then tell us a little bit about why a fellowship. So why don't we start with you, Dr. Jenny?
Sure. So I did undergrad at MIT. I double majored in neuroscience, and then I got an additional major in music.
Dummy.
Yeah.
Just for
I
fun.
mean, we really get like the bottom of the barrel with these.
Real underachiever over there.
Okay.
It was fun.
Keep
I
going.
enjoyed it. Then I went to medical school at Icahn School of Medicine at Mount Sinai. I initially thought I wanted to do OBGYN. Realized on my general surgery rotation that was not the case, and I wanted to do plastic surgery, so I decided to do a research year. I was also always interested in global surgery, and I had gotten my MPH at that point during medical school, so I wanted to kind of combine that with my interest in plastic surgery, and I was a Paul Farmer Global Surgery Research Associate for the year. So I moved to Haiti for half a year. I lived in Brazil for 3 months, did a lot of research on access to pediatric surgical care, trying to build capacity in Haiti and access to cleft care in Brazil. Went back, finished my last year of medical school. And then I went to Hopkins for residency training. So we're actually a joint program with the University of Maryland. So we also get to rotate and spend time at Shock Trauma, which is a very large, acclaimed, very busy trauma center, level 1, people being flown in with all sorts of really, really incredible craniofacial trauma that are truly challenging problems to deal with. So that was a really formative part of my training, in addition to rotating at, obviously, Johns Hopkins and spending a lot of time there doing a lot of really complex reconstruction. I think like most residency training programs, there is a large focus on reconstructive surgery, although we do get some really great aesthetic surgery experience with some community partners we get to work with. Dr. Manson always said that if you want to be a good aesthetic surgeon, you should also try and be a good reconstructive surgeon. And I feel like you talk about this a lot in your podcast, that a lot of aesthetic surgery is good reconstructive surgery. So I feel very lucky to have had that as a background kind of launching into my aesthetic surgery career.
Fantastic.
That's excellent. And it's true. I think Manson was one of my favorite guys from that standpoint. He's an incredible surgeon. But yeah, you have to know your reconstruction if you want to do aesthetic surgery
Yeah.
to take people that, look normal and try to make them look better. You really better understand your reconstructive principles
Definitely.
and be clear about what your goals. So, Dr.
My turn.
Xiao Zhu.
Yeah, so I went to Duke University for undergrad and down south. They had an okay basketball team. I did a year of research afterwards, just as a lab tech with Dr. Lefkowitz, who actually ended up being the Nobel laureate for chemistry. He was one of the first to discover G protein coupled receptors, so that was a real cool year.
Wow.
cool year.
That's kind of cool.
Just riding his coattails as long and as far as I can. Then I went back home. Pittsburgh's home for me. Back home for med school, where I was part of the physician scientist training program. So that was a 5-year track where we did a year of research between our second and third year of med school. You got a little scholarship from that. But I applied for grants. I became a Howard Hughes Medical Institute fellow for that year, just doing more research. And then, during med school, I guess, so why plastics, right? For me, it wasn't necessarily the subject matter that drew me. I don't know if you guys remember med school, but a lot of our rotations that we were on, it was...
I do remember it. I had to think for a second. I went, wow, do I remember that?
a while ago.
I want to be clear that I do remember it.
Good. Loud and clear.
Yes.
But
Thank you.
I feel
Thank you for checking in with me.
You're welcome.
All right.
Memory intact.
But for me, for our med school rotations, it wasn't necessarily the subject matter that drew me to it necessarily, but the people within those rotations, that for me made or break that rotation. And for me, I felt like I meshed the best with the plastic surgery folks. I was in between medicine and surgery, and I was within surgery, I was trying to figure out what type of surgery I wanted to do. But
You knew you wanted to do surgery.
Yeah, I did. But
You wanted
what
to
type?
serve patients
Yep.
with surgical intervention.
Yeah.
That's I think all
Yeah.
of us who do this kind of feel that when you're in
Yeah.
medical school. You're like,
Yeah.
You're one or
surgery's
the
for
other.
me.
Yeah.
Yeah, like
Yeah.
even Columbia recognized this early on because they named it the College of Physicians and Surgeons.
Yeah, there you go.
Yeah.
There's a bit
And
of that.
surgeons.
It's a bit of a divide.
I always would say that. I said Columbia knew.
Yeah.
Physicians and
And
surgeons.
And surgeons, exactly.
PNS, baby.
Different breed.
Even though our days on the surgery rotations were longer, it felt shorter because you were just constantly around doing stuff,
Yeah.
right? And it was technical, and it's just what I ended up loving to do.
That's great.
And then after med school at Pitt, I stayed at Pitt for residency with the Pitt Plastic
good
School.
program.
It's all right.
It's solid.
I think. Yeah, I
Tight.
think it's up there. Yeah. And then
Some solid players there.
I think so. Just a few. And then for me, why fellowship? You guys had mentors throughout residency, right? For all the mentors who I had interacted with, they were kind of either in one or the other camp. One camp was, you should absolutely do a fellowship. Go ahead, you're going to learn a lot. Or the other camp is like, you're good enough. Go ahead and go hang your shingle somewhere and just practice. But then you start to wonder yourself, is good enough? Is that the standard I want to set for myself and what I want to provide for my patients? Or do I really want to get that extra shine and really go into practice being that much better than I could be without the fellowship, right? And then, you'll hear, from people that you kind of learn as you go, right? The first couple of years, you just learn as you go. But, why do I want to learn as I go if I could just learn it all now, right? And then just, again, be the best that I could be out of fellowship.
Yeah, we didn't have fellowships like this
Yeah.
back in the day when I finished residency.
Just
You still remember
years
though.
ago.
Yeah.
You remember that.
You asked me if I remembered medical school. Like, residency, I definitely remember. Like, no, I remember medical school. But but I do remember that there were some aesthetic fellowships, and they were mostly like one-on-one. It was like you with the mentor, and you were their, apprentice basically for the year. And that didn't seem like it would help me when I was going to, I started, my first job was, I was a tenure-tracked professor at the University of California, Irvine. And I had guys like Greg Evans and Bruce Ackauer and, and Mark Kobayashi and Michael Sundine. These guys were, seasoned veterans, and they were my practice partners. So I felt like if I had stuff that I need to run by them, and I did, I felt like that would be better than spending a year with one person. Our fellowship's a little bit different, which I suppose made a difference for your choice to come here.
Oh, absolutely.
Definitely.
Yeah, I mean, you look at the other, and having now seen what you all do when you finish here, I think that the fellowship is very valuable.
Yeah.
I think you get a lot out of it.
Well, our fellowship is not that apprentice model. So we have how many faculty now? Like 7,
Too
8,
many.
9?
Yeah,
Too many.
it's
Too
a
many
lot.
for just 2 fellows to really keep up with. So you do get a wide breadth and exposure to faculty and the different things that they specialize in,
Yeah.
whether it's rhinoplasty, body contouring, breast, face, noses, different approaches to surgery, different, levels of experience. And I think that kind of gives you an idea of what you want to do or gives you a better idea of what
Yeah.
works for you. So it's less of the apprenticeship model and more just sort of broad exposure to a lot of different techniques
Yeah.
and options.
And there are definitely apprenticeship model fellowships out there, and I know people
Yeah.
can get some nice training from
Absolutely.
those. I think when
sure.
I was thinking about it, similar to Xiao, I really wanted to kind of really get that final polish on my surgical skills. I know, we graduate from residency, we could be good surgeons, but I really wanted to be like top tier aesthetic surgeon. And I think this, being able to learn from so many people, I thought if I'm going to take this year, this volunteer year, as you said, to spend more time training, in addition to all of the other training we've already gone through, I want to make it worthwhile. I want to learn from as many people as I can who are doing the highest level techniques in aesthetic surgery. And I really felt like this program would really offer that.
A facelift isn't a facelift, isn't a facelift. A rhinoplasty isn't just a rhinoplasty. Like, there's so many different techniques, nuances that you can't learn all of it in one lifetime. And for us, joining a fellowship with such a diverse faculty that you guys have, that we have right now, is so great because all these little tricks you pick up from each attending, you can use in the future. And you can pick and choose what you want to do. And, being exposed to that diversity of techniques, of specialties, of expertise is what really makes this fellowship and this experience shine.
Well, what are your favorite things? So we should tell everybody that you all do have your own practice while you're in this fellowship. Like you're seeing patients and doing your own cases. Like if anybody out there wants to come in and have surgery with these 2 amazing board-eligible plastic surgeons, they can do that because it's at a pretty significant
Yes.
discount.
Shameless plug for the fellows.
Shameless plug.
Come on in and get your
But-
surgery with
Exactly. You get
excellent
the fellow.
fellows
but
who
with
are
one,
with
one of the faculty
Yeah.
of this fellowship. So you still, like the last time we did this with Tyler and Dr. Obi, like some gal got on a plane from Montana and said, if Jay Calvert's standing next to this guy doing the facelift, I'm coming there. And she got it for, by the way, still not cheap. Plastic
No.
surgery is not cheap. No matter, even in the fellows clinic, it still costs money.
Yeah, costs money.
It's not like it's going to be $18. But I will tell you, back when I was at Pitt, we had a deal. I think it was $1,500, and you could get any operation you
Wow.
wanted if the residents did it. Yeah,
That
I
is
think it was something
no
totally
longer
stupid like
exists.
that.
It is.
No, I mean, I think now, I think the facelifts and things like that for the fellows clinic are somewhere in the $15,000 to $20,000 range, depending on what you're doing, which is still not cheap, but it's better than paying, our
60,
prices.
80, 90. Yeah.
Very good deal.
Yeah, it's a good deal,
For
and,
what
and
you
they get a great operation because you all are incredible operators right now. You'll be even better in 3 months. I mean, I let me ask you this: you've
Yeah.
been here. This is coming up on
1 month.
the end of your first
Yep,
month.
just the first month.
On a percentage basis, just in terms of what you thought you would be doing right now to where you are now, did you get the kind of improvement in your thinking and skills in 1 month that seems to be about what you thought, less than what you thought, or more than you thought?
Definitely more.
More, yeah.
I've seen things here that I've never seen back home in Pittsburgh.
So in 1 month,
in 1
you
month.
Just
feel
1
like
month.
there's more. You got more in this month than you thought you would have had at this
I
point.
got more in this month than I got throughout residency in terms of aesthetic surgery techniques, I would say. And I got a lot out of residency. I got a ton out of residency. But I think the fine-tuning aspect of it, and I think the benefit of everyone being so open and transparent with us and being willing to share their journey and what they learned throughout their years of practice, I have learned an incredible amount.
Yeah, I mean, this fellowship, it's just high volume aesthetics every single day.
Yeah.
Right?
Every day.
Whereas in residence, you might get some aesthetics here and there. You have a resident run clinic, you may have some elective time.
Yeah.
But this is high intensity, top tier aesthetic surgery every single
Yeah.
day,
Mm-hmm.
which
Yeah,
is
all
much,
day,
much
every
different.
day.
Yeah,
Repetition.
Exactly.
Yeah.
What's the most surprising aspect about these Beverly Hills and Los Angeles practices, what do you, when you came in here, you had an expectation.
Yeah.
But what got blown out of the water for expectations that you were just like, I did not see that coming?
How chill everybody is.
Yeah.
How, seriously,
The
just
vibes.
just how.
Vibes are on point.
Again, this is like top echelon plastics, like it's Beverly Hills, right? This is the plastic surgery capital of the world. But like all of our faculty, everybody we've interacted with, I've never had one negative interaction with anybody. No egos flying around. Everybody treats us as, they expect us to know how to operate, which that should be the expectation, right? We're not being handheld through the procedures. We're expected to know what we're doing and follow along and learn through that.
Yeah.
I mean, don't get it twisted. There are egos flying around.
Yes.
But hopefully they are not directed at you guys.
No.
And that is,
Definitely not,
you guys come in and the expectation from us is that you are already knowing how to operate, and we expect that much of you. So we're not going to baby you. We're not
Right.
going to talk down to you. We're going to respect you for the well-trained plastic surgeons that you are and for what you can bring and what we can give to you.
Yeah.
So I think I might know the answer to this, but what areas of specialty do you want to focus on that you're trying to learn from this year? What made you choose this fellowship or another one? And like, what do you want to specialize in? What do you want to get out of this year?
Yeah, I mean, I really wanted to learn some advanced techniques for facial rejuvenation procedures, namely deep plane facelift and rhinoplasty. I think those were probably the weaker points of my education. I knew I had a few techniques down for facelift that I really liked. I knew there was a lot more to learn. I knew there was a lot more to learn about rhinoplasty. So I really wanted to get just top level skills in that so I could go out and really be doing best-in-class operations from day one rather than taking a few years to ramp up to that. And I also really want to get some good experience with difficult breast aesthetic cases because I think that is very complicated. People underestimate the complication level of that, and I think learning those skills would be really helpful as well.
All right.
Yeah, and I love facial aesthetics, but I think the unique part of the fellowship here is that not only do we get amazing facial aesthetics, all that kind of stuff, but we have such amazing breast and body surgeons and faculty here as well. And going into practice, you have to be realistic, right? You're not going to go 1 year into practice and I'm just the face guy, right? That's just not how the world works.
No.
You go out there, you just
Do what
whatever,
comes, yeah.
right?
You have to be able to do everything.
Right, exactly, and you have to be well trained for that too. So, that's again, you guys do everything here. It's really amazing.
Well, and the faculty, like you have a lot of podium players here,
Yeah.
between, I think literally everybody gives presentations
Yeah.
around the world.
Yep.
I mean, it is incredible. I mean, it's we've worked very hard to assemble this, faculty, and the fact that we all agree that how important the fellowship is, because it costs us money to do the fellowship.
Yeah.
Like we don't make money.
Yeah.
I mean.
Yeah.
Maybe if you guys knock it out of the park at the fellows clinic, you might pay for yourselves, but then you wouldn't be working with us a whole lot. So that's it costs us all money to have you. We all agree that the training is very valuable for you and for us because the one thing that I get out of training you all is I get to look very carefully every day at what are the teaching points and what is it that I'm going to show you as I'm taking, care of my patients who have all come from, as you know, I get some really difficult noses and a lot of facelifts and breast things, et cetera. But as I'm gearing up my cases, and I know you're going to be assisting me on these cases, I absolutely want to show you what were the keys that this is going to work? Why is this going to work? Why did I choose this operation? Because the first time you go into your clinic after you finish this fellowship, there's nobody else there, and you have a patient that is going to be looking for the Beverly Hills trained plastic surgeon, wherever you guys go practice, to knock it out of the park for them. And so that you will operatively knock it out of the park. But I think surgery is won and lost in the diagnostic and assessment moments and really deciding what operation to do.
Yeah.
I think we can all operate. That isn't a problem by the time, especially you guys are where you are in your through your training. You can do surgery, but decision-making in plastic surgery and thoughtfulness and mindfulness and artistry, you just don't get that in residency. It doesn't happen. They don't show that to you the way that you do when you're in somebody's practice with them. And that's where, I mean, especially, I'm sure you already see you go from each one of the attendings to the next, it's very different. Everybody's got a different way.
Yeah.
How valuable, right?
Yeah.
It's like
Yeah.
you get all these different looks from people that are doing it at a really high level. I think it's tough to beat.
Yeah, I 100% agree with that. You know, in residency, you're like, to your point, you're just learning to operate mainly, right? You know, get
your head
those
above water,
exactly,
yeah.
get those techniques, you know, under your belt. You know, suturing, cutting, whatever it may be. But we don't get enough of those, like the decision-making aspects of patient care. You know, the markings. You know, where are you going to cut? What are you going to suture? That's the stuff that's missing, I think, from residency that we get from fellowship.
Yeah, the artistry is really key. I mean, I remember one of our, former resident and fellows who came through. Like, I was overseeing one of their cases, and when they're done, I said, "So what do you think? How'd it go?" And they looked at me and they go, "Yeah, went great. Got it done in an hour and 15 minutes, and no problems." I go, "Yeah, but what do you think of the result?" And they looked at me and they were kind of like,
Result.
There's a result.
I don't know. I mean, it's done, kind of was the point.
Yeah.
And, then I said, well, you did a good job and the result is fine. So in your haste to be finished, like you never took the opportunities to make this better. Mm-hmm. Like it's a fine result. Like it was okay. Like did the job, patient was thrilled, everything was perfect. What I saw, because my eyes see things so differently, is there were so many opportunities to make it better. So many opportunities to make this operation, go to the next level. And if you can get that while you're here for the year, where you see the opportunities, because again, you won't see what you don't know to look for, right?
Exactly.
You must know what you're looking for if you're going to make it better. And so that's what you want to learn. That's where you want to go. And I've seen that with the fellows that have come through here. They all have that, which is really valuable. And it just is going to make you a better surgeon for your patients.
Yeah.
Yeah, I think training our eye is really important. I was looking at one of the rhinoplasties we did yesterday, and I was talking to a visiting resident about what I thought would be wrong with the lower laterals, and I was thinking, wow, I feel like I can already have a better visualization of what the cartilage is going to look like before we get in there, because I've been able to see you go through this, see you kind of talk about your decision-making process, what you think's going on kind of underneath the skin, behind the curtain, and I think that eye and that ability to sort of x-ray vision, see what's underneath and what problems you're going to have to fix is really key.
Yeah, I mean, if you guys, I'm so excited for what you're going to go through this next year. And we're definitely going to bring you back closer towards the end of your fellowship to see what you've learned, see if you still love being here and you're not completely sick of us yet.
Yeah, if we don't do this, you'll know the answer.
They'll know the answer to that. Yeah, they'll be like,
If we can't get them back in, they'll be like,
That episode won't air.
Yeah, that didn't happen.
and then you'll be able to tell us at that time, where you're going and what your practice is going to look like. You should probably have some answers by then.
Hopefully.
But until then, your job is to enjoy the remainder of this year, and I have no doubt that you guys are going to be excellent.
That'll be easy
Thank
to do.
you. Yeah.
So what do you think? Let's finish up with just your 3 major goals for this fellowship, and we'll see if we come back. So just think for it in a second, Lynn. We're going to come back, and we'll probably do this on that 10-month and 22nd day, or 23rd day, just so that we don't get too far along. But what do you think are right now, when you're looking down, my goals for this fellowship are to understand rhinoplasty, be competent at, whatever, just whatever you think your 3 top goals are. We'll start with you, Xiao.
Okay, so one is kind of a no-brainer. Just learn techniques, whatever it may be, from all the faculty, put them in my pocket so that I can use in the future or not, depending on what I do and how I want to manage my patients. Number 2 is learn more post-op management. I think a lot of residency, again, we didn't spend a whole lot of time in clinic, especially kind of analyzing our results or complications and things like that. So I want to get better at learning how to manage patients post-op, whether it's a complication or not. And then finally, I think managing patient expectations is something that's super important.
Why is that important?
Oh, I mean, if you and the patient are not on the same page with what you can provide them, that's just disastrous afterwards, right? That's just an unhappy patient and an unhappy surgeon, and that's just Bad news bears.
That makes for a bad day.
Yeah. It does.
Not fun.
Bad
Nope.
clinic day. Yeah.
All right. Dr. Jenny?
All right. I feel like there's many, many goals, but to stick to 3, I think, similar to Xiao.
I like lists.
Yeah.
Do we need a whiteboard? Okay.
I think we'll be okay.
All right, good.
I'll refrain.
All right.
I think developing a solid baseline approach to all of the procedures that I want to do head to toe, knowing the techniques that I want to do, and then having options for if things look a little different in the OR, if something's not working out, some bailout plans. I think, like Xiao said, being able to manage the pre-op discussion and sort of handling diagnosis and what I want to do for a patient and being able to handle all of those questions with ease, I think is something that is a skill we'll have to learn.
Wow.
And then I want to learn a lot more about practice management and kind of the business side of things, because I think training in an academic program, we don't get as much experience about what private practice is really like and all of the different intricacies of having your own operating room and navigating that and having hospital privileges and all of these different things, dealing with staff, that I think is a whole nother education in itself.
It's a whole other master's degree that we're just expected to know how to do. On
With
day
no
one.
other training.
With no training. Like, you do this now. Go run a practice in a business.
I feel like we all need to get MBAs, out of residency to know how to run a
We all
practice.
probably
and
should.
we're expected to be business people without knowing anything,
Anything about
it,
business,
which is, I guess, just the world.
No, you
we
do
live
need
in.
to learn that stuff while
Yeah.
you're here. That's really important, and you
Marketing,
can learn
management.
it. Absolutely.
Yeah.
And you've got a lot of good examples of how to do that. It's done differently at every place, and you do need to learn that part. That's a big part of the factor. Where do you think you'll wind up practicing? What part of the world are you going to practice in?
I'd like to go back to the DC area, DMV, somewhere in that area, be closer to family.
Would you go back academic if there was a job for you, or would you go private practice?
I'm open to both. I think I'm certainly going to cast a wide net within that area and kind of see what's out there, what the different jobs would involve, and what would best suit what I want to do.
Cool. Xiao, what do you think?
Midwest, East Coast. All my family's on the East Coast, and it's sometimes it's just hard to get.
Isn't
away from
everybody
family.
in the Berg though?
in Pittsburgh specifically? Yeah.
Yeah, so one of those guys got to be ready to retire. I mean, seriously, some of them are like 11 over there. It is like
Some are trying to achieve immortality.
I know. It's like, I mean, come on, guys. Like, there's got to be somebody that needs you there. I'm sure.
I hope so.
Would you go to? It would be Berg on the top.
Probably,
top
yeah.
of the list, but
Yeah.
you'd go somewhere on that part of the. world.
Somewhere close to family, whether it's Pittsburgh or somewhere nearby within driving distance.
Where's your wife from originally, though?
Pittsburgh.
Oh,
the
well
Burgh.
then that's it. That's
She was
over.
born at McGee.
Oh no.
I think we know the answer.
Excuse me. I know. If your wife's from Pittsburgh, at some point,
You're going to be in
at
Yeah.
some point,
Yeah.
I don't know when that'll necessarily.
I've surrendered to that.
Yeah, my best buddy from residency was John Wallig, who is a neurosurgeon in Portland, Maine. And every time I talk to them, like, so when are you guys moving back to Pittsburgh? Because his wife's from Pittsburgh. But so far, so good. They've stayed in Portland. So
He's
you know.
resisted.
off,
He's
yeah.
fought.
I think she likes it there too, though, and their kids are great. Yeah, I mean, they've got Portland, Maine, by the way.
Really.
Beautiful place.
Yeah.
And
Check
by
that
the way,
place
not
out.
far,
Heard
not
good
far from
things.
Boston.
Yeah, very good things.
Really beautiful. Yeah, they have a great setup there. I mean, just wonderful people. So, but yeah, that Pittsburgh, I think, would be. I'd love to practice in Pittsburgh. It's amazing.
We'll open
there.
something together. How about that? We'll bring Dr. Rovelo with us.
Let's do that. Let's go. Like, you
I love
won't
it.
get her out of L.A. You won't get her out of the East Side.
No.
Never mind. I mean, the fact that she practices in Beverly Hills is like
Yeah.
a total like misnomer. You know, it's kind of. But yeah, it's true. Why don't you you should have something over on the East Side there.
No.
That was a pretty stern.
Yeah.
Yeah,
I love my East Sider people, but I think for plastic surgery, Beverly Hills is where it's at.
Yeah, it's a pretty good. We got a good zip code.
Place to be. Yeah.
I mean, we are doing this from the 90210. Literally. We are literally podcasting from a mansion in Beverly Hills. That's that is a very different kind of setup. Well, we appreciate you guys coming on. Do you have any questions for us before we go? Anything you want to ask about the fellowship? Anything that wasn't answered for you in your first month? Or are you good to go?
I think we're good
I think
to
we're
go.
having a great time.
Yeah, it's going well.
Sometimes I have
Yeah.
to pinch myself in the mornings to
Yeah.
tell myself that I'm not in a dream anymore, that
Yeah.
I'm doing plastic surgery in Beverly Hills. Like,
I
where
know.
else?
Where else would you want to be?
for that? Yeah.
But seriously, don't you think like that people would be shocked about how not Beverly Hills it really is?
Yeah.
Yeah.
It's
Like-
very
Yeah.
different.
Right? The misconception that it's like you know, I say, what do you guys think we're doing out here? Drinking Perrier and eating bonbons and playing golf by
But
1
people
o'clock?
work hard here. People
work our
work
butts
very
off.
hard.
But
Right?
everyone's very easygoing, and so I think it's. I knew it was going to be the perfect environment for me, which is another big reason why I wanted to be at this program. It's like the most amazing learning environment, and a great environment to be a patient in, I'm sure.
Yeah, well, the patients, I mean, we got a lot of those for sure.
Yeah.
We're all very busy, but I think people have this misconception that, like, you know, we did a forehead flap on Friday night at, 7 p.m. Like, that's...
It was really fun. I had a good time.
Like, if we threw that out there to all your attendings back at the other institutions,
They
we'd be
would
like, what do you think
not
we did
know.
on Friday night?
Yeah, that would
in
not have
the
been their
Roxbury
top
Clinic
Forehead
and
flap would
Surgery
not be in the
Center.
top 100
Yeah.
procedures
Yeah.
that they would have listed.
Activities, yeah.
And we did well. It's
Yeah,
coming along.
yeah.
It looks really good. We're
She
gonna
looks great.
fix her up. She's gonna do
Yeah.
great. But so I think that's the part that people don't realize is that we're actually working our butts off here. And I work like I'm still resident. I mean, it's kind of what's made it go this way. And I know Dr. Rovelo is exactly the same. She works like a dog, especially the stuff she does at the hospital. It's terrifying. I just will tell you both that. So if you ever want to see some cases that you never want to do, just ask her to show you what she does in the hospital.
Perfect.
It's mind-blowing. All right, well, we appreciate you guys coming on. Have a great year. We'll circle the wagons again in probably in May or June and talk
Beautiful.
about this again.
Perfect, yeah.
And this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.